ഗുരവേ സർവലോകാനാം ഭിഷജേ ഭവരോഗിണാം നിധയേ സർവവിദ്യാനാം ദക്ഷിണാമൂർത്തയേ നമഃ. Namaste to all. I hope your minds are preoccupied with the return journey today, isn't it? After a long week stay. Have you enjoyed? Yes. Very good. So I'm happy that I have got an enthusiastic gathering here to address today. I hope that I will try to make the session equally enthusiastic. Next slide, please. So these all forefathers have been leading us, my family members, throughout generations. They say that the Ashtavaidya Parampara, the tradition of Kerala, are followers of Vagbhada. Usually we don't pronounce Vagbhada. The Ashtavaidya tradition, they pronounce it as Vahada, following the Jain tradition, Vahada. So they don't use the Guru Aksharas, Vagbhada, that is a Guru Akshara in Sanskrit because of the Sandhi. So even if you see the manuscripts, so for example at my home, the oldest manuscript of Hindu Vyakhyana, the Shashilekha commentary, is still there. So if you open the manuscript page, you will see Vahada only, no Vagbhada in it. So Vahada, Tisada, Chandrada, all these are that tradition, isn't it? So these Ashtavaidya families are believed to be the followers of Vagbhada, and they were very fond of teaching and practicing based on Ashtanga Hridaya mainly. I always used to remember my elder uncle, Ashtavaidyan Chariyanarayanan Nambudiri, who guided us. He used to say that the first 14 chapters of Sutrasthana, Ashtanga Hridaya, is what we study and study. The others we keep referring, but we have to always, dig deep into the Ashtanga Hridaya first 14 chapters, Sutrasthana first 14 chapters. The rest will follow. As a matter of fact, I have seen another famous Ashtavaidya, Alatiyur Narayanan Nambi. He passed away very recently. Like the Bhagavad Gita recitation competition and all, you tell a verse, you start a verse, he will continue it from there. Whole Ashtanga Hridaya, because that is his regular practice. Even while going for bathing, even while going taking a nap, he keeps on reciting this. It's not for a competitive exam, not to attend a competitive exam and all. So they take it as a ritual, they take it as their passion. So that is how this tradition has been maintained till now. Okay. And next slide, please. Today, I am very happy that I have been given a topic for which my great uncle was very famous. So they say in Malayalam, Vaidyamadhaminte Nasyam valare kemamanu. Means the Nasya done at Vaidyamadham is very good. Actually that is a Dvayartha Prayoga. In Malayalam, if you say Nasyam, it's something like humor. You tease someone, you make fun of someone. So for that also we use the word Nasya. So they say that Nasya is very good at Vaidyamadham in both ways. Okay, the procedure and also from the tongue. Both are very good. So anyhow, they have given me this topic. I am very happy with that. So as we are all teachers, I think the session will be interactive. I am not going to follow a monologuous presentation style. Wherever possible, just raise a hand, we will interact. My slides are always breakable. There is no issue of interruption. Don't feel hesitancy. You can raise your hand. So first of all, I want to draw your attention to this wonderful work by a non-Indian. He is Manuel Joseph Vivera, an Australian, who did a systematic review on Nasya, especially in Ardhida. It was very interesting. I was following this work since its synopsis period. I noticed this synopsis. At that time, the study was going on. And recently, the study completed, and he has submitted it to the University of Adelaide, I think, isn't it? Yeah, University of Adelaide, Faculty of Health Sciences. Okay. So what he did is very interesting. We keep to learn Ardhide, Navanam, isn't it? The Chikitsa Sutra, and we claim efficacy for the Nasya Karma practiced in Ardhida with various medicines, maybe Karpasasthya Taila, maybe Kshirabala Taila, maybe something else, whatever it is. So he wanted to do a systematic review of all these studies in Ardhida. So let us just see what comes out. Next slide, please. So the objective, you can read it I am not going to read word by word, isn't it? So to draw the evidence-based recommendation, that is what his objective was. That he wanted to look into these studies which were done with Nasya as the intervention and Ardhida as the population. That is what his objective was. Next slide. So what he did is that a total of 4,321 records he got as research works done on Nasya in Ardhida. Imagine 4,321 total records he could find out, he could trace out. And finally, after several steps of careful consideration, he made a decision with the guidance of his research team and all, that only 2 studies, only 2 out of 4,321 studies could be taken for consideration. Okay, how it was done? There is a flow chart. Next slide, please. See, 4,309 records, 12 additional records, combinedly 4,321. There were duplicates. That is common because sometimes the title itself, recently there was a big joke. One of the retired principals who was doing PhD study submitted his pre-synopsis draft. Viva, final PhD open defense Viva, and he gave a draft to the university. University called him back and was telling, अरे जी आपके टाइटल अलग है, जो टाइटल आपका गाइड ने दिया है वो टाइटल अलग है, आप जो टाइटल आपने दिया है वो भी अलग है, वो यूनिवर्सिटी में क्या रजिस्टर किया है वो भी अलग है. So this happens everywhere. So there are several duplicates. Okay, so some duplicates are removed. Then the number came down to 3,124. And on review of abstracts, some records were removed. 12 were selected. 10 studies excluded because full text was not available. So this is something what I think especially teachers at PG centers should be careful. There are several opportunities or several stages to share our studies. Very simple research gate. Very simple one. You can keep restrictions on sharing your study. Not that everyone can download it and copy it. You can administer with whom you can share or not. But if we don't share, what happens is that duplicates keep on coming. See the number of duplicates. Almost 1/3 or 1/4 were duplicates. That is because some studies are like that. Not only title, the work is also done same objective. Okay, usually very number of theses come for review or synopsis comes for review. So what we see is that first whether it is duplicate or the work has been done earlier. When we see that itself, the interest is lost because many of the works are already done. Okay, then after that 10 studies were excluded, 2 studies were taken. Now at least he got 2 studies. What happened still? We will see. Next slide. So one study was done by one Tanki et al. So that study, Mashadi Thailanasya, Anu Thailanasya, were administered to 2 groups, 10 participants each. Disease was Ardida. Next slide. In the other study done by Gupta et al., there was some preparatory treatment and all, Virejana, then Nasya was given with Mahamasha Taila, another medicine. Okay. Additionally, some intervention, they received Brihadvada Chintamani, some Shamana Ushadis also they received. So this is what Manuel Vieira was reviewing, was analyzing. Only these 2 studies. One, a study with 2 groups, Nasya in it, and another a study with a Shamana Ushadi protocol in it. Okay, next. So see this table. This is the evaluation strategy. A few questions were asked regarding the value of these studies. Okay, and based on those 10 questions, what was found was that overall both these studies, which qualified out of the 4,329 studies, both these studies were of very low quality. These were pseudo-randomized trials, not true randomized, but that happens even in modern medicine. It's not fair to criticize Ayurveda alone. So his intention was also not to criticize Ayurveda. He was not intending to make Ayurveda a culprit. We will see that his conclusion, what was his take-home message, then we will understand that. Next slide, please. So what he was saying is that due to the high risk bias in the 2 studies and the limited number of participants, the results should be treated with extreme caution. What result? Ardide Navanam. That was the objective, isn't it? So, consequently, conclusive evidence-based recommendations to guide practitioners about which of the Nasya, that means whether Mashabala or Mahamasha or Kshirabala, whatever Nasya should be done in order to relieve Ardida symptoms cannot be made. So this is the drawback what he found out. Along with that, he made some positive recommendation. I think that is where our sessions like this, the ROTP for teachers and all, should be discussing, because we are always in the process of showcasing ourselves in a very, very beautiful manner, isn't it? So how to do research or how to do studies on our conventional treatments, how to present them, how to make them more, realistic, all these we need to carefully consider. Research for the purpose of research, that is mostly what happens. Next slide, please. So what he recommended is that Nasya being one of the safe Panchakarma procedures. See, after reviewing he still believed that, okay, efficacy part there may be some lacuna. I couldn't find any evidence-based recommendation. But still, Nasya is the safest procedure among Panchakarma. And it is widely used by practitioners and researchers. In case of Ardhida, there is no standard format for determining outcome measures. That is one reason for possible bias, and to offer credible, repeatable research data. So, developing outcome measures in disease. So, when we are discussing Snehapana, or when we are discussing Virechana, or when we are discussing Nasya, the outcome we measure in terms of Samyak Yoga, isn't it? We see whether our procedure worked properly or not in terms of Samyak Yoga. So that Samyak Yoga, into that we should try to incorporate realistic disease outcome measures. So if we want to say that your Snehana in a particular condition, say Parinama Shula with Indugandha Ghrida, or Virechana with Avipattikara in Amla Pitta, or this Nasya itself in some disease has got good outcome, that outcome should incorporate both the procedural outcome and the realistic disease outcome measures. So that means that in each disease, the Samyak Yoga will be unique. So what Samyak Yoga you will get while doing Snehapana in a Parinama Shula patient, the same features may not be true in some other conditions, because some of the features are disease related. So say, for example, in a Vata Vyadhi, while doing Snehapana, how will you get Utklesha? Isn't it? It is an Amurta dosha. Utklesha can occur for Murta dosha alone, or for Dhatu, or for Krimi, isn't it? It is always something materialistic, isn't it? For Vayu, with its gunas, like all this Ruksha and Chala and all these gunas, it is very difficult to get Utklesha. So many of the Samyak Snigdha Lakshanas are more overlapped by the Vyadhi Shamana measures. So that is why I think you will definitely in your practice, you will have seen some cases of chronic psoriasis. Well, you will be planning Shodhananga Snehapana and planning for Virechana or Vamana. But during the Snehapana itself, the patient's lesions are responding well. There is Shamana occurring, with the Vyadhi being Vata dominant. So in that case, the disease outcome measures are more evident, not as in Kabha Pitta stages or in initial stages. So this gives us some idea regarding how to develop these things. So that is one point what he wanted to highlight. The other one, the Purvakarma is administered prior to Nasya. Same outcome measures need to be taken before and after Purvakarma. So this is a very difficult aspect, because so this is something that only Panchakarma teachers can address. That is why I am putting this. Nobody else will look into this area. If you are going for Nasya, before the Nasya, you are going to do Pradeshika, Abhyanga and Sweda. Okay. So what happens before and after that, how you are going to measure, it should be the same how you are going to measure after Nasya. Then only disease outcome can be said. Of course, procedure outcome, you will not get the Samyak Yoga of Nasya in the Purvakarma. That is different. But procedure, disease outcome, it should be the same. So these parts and all are very, very, I think, specific and can only be addressed by teachers or researchers from Panchakarma faculty alone. Nobody else is concerned about these faculty. In Kaya you do study. They just say that the disease is cured, or the dose is so and so, or there is a safety aspect studied. That's all. But only in Panchakarma we need to address these issues. Okay. Next slide. So, just throwing this background, I am going to discuss with you the Nasya Karma procedure. Let us see what all modifications or additions or even controversies we have to address. Okay. So Nasya Karma, next, considered as a unique nasal drug delivery application in Ayurveda, different from what the nasal drops in the conventional medicine. Okay, the nasal drops or in nasal installation in conventional medicine is gathering attention. We know that there is a vaccine work going on, isn't it? Everybody are aware. The most safest or least invasive method of this COVID vaccination is being developed by Bharat Biotech, nasal spray. And even recent advances in anti-diabetic management have found out the insulin administration through nasal drug delivery. Isn't it? So this area they are working on, modern medicine is working on very much. We have several advantages because we are sitting on these loads of information for some 3,000, 4,000 years. Okay, let us see. Next slide. Next, one more click. So why this mythological consideration and all? We know the consideration of Sharira in Indian philosophy. It is considered as Urdhva Moolam, isn't it? The Shadchakra, Shadangam, Angam, all these concepts are very familiar to you. So, Moola Praharinaha Tasmat, as the Shiras is the Moola, all those diseases that affect the Moola has to be addressed very fastly. Moola Praharinas Tasmat Rogan Shikhadaram Viduhu or Jayet. Next slide. So utilization of nasal route in management. Next, keep on clicking. Purification of bodily channels limited to Urdhvanga. Why I am saying is that, see, when we are thinking about how Acharya came to the number 5, Panchakarma. Why did not he stop with 4? Or why did not he go for 6, 7? So it's an open-minded question, and there is no ready-made answer for that. See, Charaka says Chatushpragara Samshuddhi, isn't it? He says Shodhana Karma are 4. At the same moment, he says that Panchakarmani Kurvita. So, how he is differing in the number? Did he miscalculate? Do you think that Charaka missed that? No, that cannot happen, isn't it? So, when we study the Shodhana Karma definition, that definition in that only Shodhana is 1, isn't it? Then they say that Shodhana is 2. Sushruta says, Pradhanyena Vamana Virejane Vartade Nirharane Doshanam. See, a Kayajivisa concept is thrown light by Sushruta in the Vamana Virejana chapter. If you see for PGs, in Vamana Virejana chapter of Sushruta Chikilsa Sthana, you go and see. There the Chikilsa Siddhanta is being discussed by Sushruta. He concludes, this Vamana and Virejana are made only for Shodhana of doshas. They don't have any other purpose. So if you see the Dvidhopakrama and Langhana and Brahmana as the 2 Upakramas, Shodhana always fall under Langhana, isn't it? There is no option. But Shamana can fall under Brahmana also. What 2 karmas are the standalone or the unique or the true Panchakarma or Shodhana Karma or Vamana and Virejana? There cannot be any Shamana or Brahmana Vamana, Brahmana Virejana. But Vasti can be there, isn't it? Brahmana Vastis are there, Brahmana Nasyas are there, Snehana Vasti is there, Snehana Nasya is there, isn't it? So that's why Sushruta says, Pradhanyana Vamana Virejane Vartade Nirharane Doshanam. Then he takes into the concept. So one goes into two, then he tries to relate that to the doshas, Vamanam Virejanam, to the doshas. So there are three doshas. So the third provision for the third one has been made. So the number went up to 3. Then what he did is more interesting. Then what he did is tried to extend Vamana to the Urdhva Jatru, considering Shiras as the Uttamanga. That is what we are trying to say here. Shiras has been given prime importance among the Sharira Avayavas, along with the other two marmas and all. So what he thought is that, see, what all Shodhana Karma we have been discussing till now. Okay, Vasti can go up to Apadam, Talamastagam. Okay, there, the effect of Vasti is there. That is true. But is there a dedicated Shodhana Karma for Shiras? Yeah, I should make provision for that. So he thought about delivering the medicine through the nasal route. And he put Nasya in that place. And then, so far, this concept which was limited to Dosha Shodhana now became Ashaya Shodhana. See, Shiras is an Ashaya, Uttamanga. So you are doing the Shodhana of the Ashaya, isn't it? Urdhva Amashaya Vamana, Adho Amashaya Virejana, Pakvashaya Vasti. So the concept changed from Dosha Shodhana to Ashaya Shodhana. From there, Sushruta and Ashtanga Sangraha took one step more forward and tried to incorporate a Shodhana for the most old dhatu in the body, that is Rakta. Ashtanga Sangraha, there is a very interesting quotation. Anyat nahi tadha doshyam. Anyat nahi tadha doshyam. There is no other doshya as Rakta. Why? Yadha Raktam adhishthanam vikaranam vikarinam. How Rakta becomes the substratum for vikara, that is the roga, disease, and vikari, the dosha, which are the morbid factors. There is no other dosha like that. This is the dhatu that has got chala guna at the extreme capacity, isn't it, compared to other dhatus. So Rakta is the odd. If you ask somebody to pick the odd one among the dhatus, it is Rakta that you pick, because of its extreme relation, huge interaction with the doshas. So they tried to put Siraveda as the Shodhana for the Dushita Rakta. So this is how I believe that Acharyas were thinking while developing these numbers. Okay, then there are the controversies, which 5, what 5, okay, that is always open, because we cannot go back and try to bring in a solution between Russia and Ukraine, isn't it? Charaka might not have read Sushruta Samhita, Sushruta might not have read Charaka Samhita. Had both they read each other's Samhita, some of the opinions may have not been there. We cannot find a solution to that. So there is no point in quarreling which one is good, because we get these questions very frequently, isn't it? When we go for classes and all, which school of thought you are, these questions come. So I think we should take it in a right spirit. It's not to challenge one Acharya or disqualify another Acharya. We are trying to rationalize it so that how we can assimilate it, isn't it? After all, we are the persons who are using these things. We have to understand it, isn't it? So the dosha karma of Nasya, we cannot say that Nasya is Vada Shamana, Nasya is Pitta Shamana, Nasya is Kapha Shamana. We have to say Nasya is Tridosha Shamana with respect to Urdhva Shodhana or Uttamanga Shodhana. Okay, next. So the broad spectrum of Tridosha is can be addressed through Nasya Karma. Next please. So vast applications, some consider it as an extension of Vamana. You know very well, isn't it? Nasta Prachardanam is one synonym. Nastaha Prachardanam is one synonym, not mere drug administration. So this is where Ayurveda drug delivery differs from modern. Modern medicine consider it as mere drug delivery. So here we are not sure that our drug is intended to absorb always. We will discuss that later in the while we are winding up. Mode of action. Okay. Intended at achieving purification of channels of upper body. Yeah. Next slide. Click on. Okay. Once more. Okay. So this is why I think Chakrabani tries to find out an additional point regarding consideration of Nasya. Anamaye yadha mule vrikshaha samyak pravardhade anamaye shirasyevam dehaha samyak pravardhade. So you have to address problems of head with that importance. So that is why we are discussing Nasya in detail. Next slide. So the contents can click on. So you are going to touch all these portions, just discussion part only. Okay. Yeah. So you are all teachers. I am not going to teach you the terminology. You have been teaching for years and years. Okay. So I just want to discuss with you which etymology and which definition would you give preference, priority, which is the most suitable or a total one. That is what we should consider. So when we are evaluating an answer sheet or when we are going to make a presentation to the UG students, first which should come? Which definition should come? According to that we have to plan, isn't it? According to that we have to make the lesson plan. So that is why I have put this, not to tell you the etymology and definition. You already know all those things. So here there is the commonness of the nas dhadu in that, isn't it? So I told you the two meanings of Nasya in Malayalam. As such, there are not two meanings of nas in Sanskrit. In Sanskrit it's only one meaning, so which means spreading, isn't it? Then next slide. Full, you click it full. So lot of, I just compiled from different texts. Lot of them are available as etymology and definitions. Nasigaya hidam, nasigadeya churnadi, nasayam bhavam. So how did the ya come in Nasya? Nasigayam nasadeshaha. Lot of, so when you are trying to speak in terms of language, you can put nasigayam nasadeshaha at first. When you are trying to give the meaning, you can say nasayam bhavam. Okay. So because spreading means different modes, different applications of Nasya are there, like churna, powder form, liquid form, isn't it? Extract form, kashaya form. So what aushadam, aushada siddho va sneho, nasikabhyam diyata. Next slide please. Then nasagrahyam yadaushadham. There is another definition which appears to be more wholesome to me. Okay, I am sharing this with you, so you can either discuss if you have a point to make, or later on you can think over it. Then Nastaha Prachardanam, I told you earlier, that is why it is considered as an extension to Vamana. Okay, difference only is that the mode of administration is through a different part, but the mode of elimination is through the same part, isn't it? Charaka Chikilsa, Yoni Vyapat Chikilsidam, 30th chapter. After all the Yoni Vyapat are dealt, there is a portion which is left untouched in UG. Usually people don't study. They say that, oh, this you have studied in first year, Aushadha Kala is there. So same thing you write here. That's all. That is the most important portion of Charaka Chikitsa, I consider. Because for a Kaya Chikitsa person, or for a Panchakarma person, that Charaka Chikitsa 30, the remaining of Yoni Vyabhat is very, very, very interesting. There are a lot of concepts. Gudha Dosha Chikitsa, then Bheshaja Kala, then this Ashaya Shodhana, Samipa Ashaya Shodhana, a lot of concepts, mode of administration, route of administration, lot of things Acharya has discussed in that. Probably it was where Dridhabala started the text. That is why it has made so beautiful. Because maybe at one time, period of time, Charaka Chikitsa was available only till this Yoni Vyabhat. And that's where Dridhabala decided to complete it. So he started. Where did he start? He did not start with Charaka Siddhi. He started with completing the Charaka Chikitsa 30th. That is what I believe. There are no historical proof in it. Lot of persons have studied in that because it is written so beautifully. So beautifully, and even the commentators have dealt. Chakrapani, I think you will find the Chakrapani commentary most elaborate in Charaka Chikitsa 30th chapter. Even Jajjada commentary, which is partly available now from on the BHU edition, Arad Singh edition, Jajjada commentary also will get some portions of it. Next slide, please. Yeah. So finally, if we say the definition of Nasya, you can say administration of medicine directly. That means medicine which is raw, unprocessed. That is what I mean by directly, or in processed form, like churna or sarasa or kshirapaga, taila, krida, whatever be it. Okay. The processed form can all these things, can be all these sort. Then there are different classification. So if we start considering each classification, we can understand that the purpose of the classification is different in each case. One classification focuses over the technique, like Charaka, Sushruta classifications. One focuses over action, Kashyapa. This is one occasion where Vagbhada has rarely deviated from following Charaka and gone on to follow Kashyapa. Okay. Then Sharangdhara also, he has also vouched for the Kashyapa classification. Hemadri gives an additional information of classification of Nasya basing on Virya, potency. Then posology, all of the Acharya have mentioned this posological classification. It originated from Bhoja Samhita. Actual first contribution of Bhoja Samhita into Panchakarma is regarding the classification of Nasya. I don't know whether the Bhoja Samhita available now is the original one, but if it is the original one, it is the oldest one. Okay. So then the drug part, which Charaka only says. Moolanasya, in PG competitive exam, that is a big question. Bhalanasya, Moolanasya, something like that. Then, so this Hemadri explanation on that posology and the action based, I have just quoted some text. Shamanam yojayet purvai kshirena salilena va. This is a quotation you will find in Ashtanga Sangraha and Ashtanga Hridaya. So what he says, Virejanaha shamano va nasaya praniyamanaha kalko avapida samjaha. So what Sangrahakara clarifies is that it is nothing other than avapida itself. What Virejana Nasya or Shamana Nasya you are speaking of, that is also avapida. That is what he says, Sangrahakara says. So Dalhana quotes Videha and says that this two, that is Virejana and Shamana, twofold classification of avapida is useful in certain condition. Vishartadinam samnya prabodhanatvena. That is the Tikshna Nasya. Raktapittadinam stambhanatvena. That is the Shamana Nasya. This was mentioned by Videha Samhita and quoted by Dalhana. So this part, Hemadri concludes that, so the Nasya can be classified on the basis of potency, Tikshnatva, Mridutva, and that is called as this Avapida Shirovirejana. So when you say that it is Avapida, Hemadri says that that is always Shamana or Stambhana, and when you say Shirovirejana, it is Virejana or Samya Prabodhana, Tikshna, etc. Next. The technique based classification is what? The Navana, Avapida, Pradhamana, Dhuma, Pradimarsha. Because you see, each are different technique. Isn't it? In Navana, what is the technique? It is pouring, Sejana. In Avapida, what is the technique? It is squeezing. In the other one, Pradhamana, it is blowing, Bhutkarena. Isn't it? Specifically they say Bhutkarena. Dhuma, technique changes. You have to ask the patient to inhale it. Isn't it? Then in Pradimarsha, slight difference from the pouring, it is only dropping. Nastaha sneha angulim vidya. Just drop it. That's all. So that is the technique based classification. Next. Action based, we can classify, or you can try to bring those 5 into this. Isn't it? Under Virejana, you can say Avapida, Pradhamana, Dhumana will fall. Under Brahmana, you can say Navana and Pradimarsha will fall. Shamana, anything can be Shamana. Isn't it? No matter which Anutaila, it is at the same time mentioned for Sosta and Adura. Isn't it? First, Acharya says about Anutaila in which chapter? Dinacharya Adhyayam. Okay. In Charaka Samhita, the name is different. Tasyashidya. Okay. So there Acharya says about that Anutaila, isn't it? The alternate day practice, the 7-day course over 13 days, all these things Acharya mentions for Sostha, not Adura. Isn't it? Next. Then the posological classification of Bhoja, it is Marsha and Pradimarsha. We always used to neglect this term Marsha. What is the meaning of Marsha? I was lucky enough to have a very senior faculty at Kottakkal who used to ask this every time he meets me. And every time I was clueless. When I joined there was Dr. E. Surendran. Dr. E. Surendran, he recently passed away. He was the professor and HOD of Kaya Chikitsa at Kottakkal Ayurveda College. He was a PhD holder from Jamnagar, very senior faculty. So whenever we go for a tea, he will ask me, you tell me what is the meaning of Marsha. I was clueless. For many years I was clueless to say. Can anybody throw some light on that?
What means in higher doses?
Okay. And that is based on this posology. So Pradimarsha is lower dose, Marsha is higher dose. But just like we say, Nasya came from Nasudhadu, which is meaning spreading. How did this word Marsha come? Because you go for the lexicon, you will get confused. The term Marsha can be coined from both Mrushadha. Next slide, please. Mrushadhadu. Can you go to the Marsha slide? Then we will come back. Next. There is a Marsha slide. Yeah. It can be coined from Mrushadhadu and Mrushadhadu also. Sha. Okay. Actually, if you want to mean like spreading, then Mrushadhadu is more suitable. Then you have to write actually Marsha, not Marsha. If you write Marsha, the Mrush, this dhadu means to touch, not to cause sneezing. That is what Monier Williams say. Actually, Mrush means to touch. So you are trying to stimulate, just as in touch. the nasal organ, the sensory organ located here. Okay, that is why Mrisha Dhatu is taken and Marsha word is coming. To say it is spreading nature, you have to actually say Marsha, but I don't think nobody uses that term most frequently, but actually Marsha is the correct word. The Monier Williams just concludes it as a sternutatory substance such as pepper, something that causes sneezing. That is what you say for Marsha. But we understand that is not the proper one. Okay, can you go back to the Pradimarsha? Yeah. So the Pradimarsha, which is the lower one, is just opposite. So Pradimarsha, it is not as efficient as the Marsha. So it is self-instilled, lesser dose, prophylactic, indicated for all age groups, no requirement of compliance, no complication, long-term utility, all these things. Okay. Then, next. Here comes one important factor, which we will try to incorporate in the demonstration also. So, the Marsha classification is based on posology. What is the basic unit? It is Bindu. In Ayurveda, especially in Panchakarma, most of the units are body index specific. So if you say Anjali, it is not always ml. It cannot be equivalent to ml always. If you say Prasrudha, it is body index specific. Like Kunjida Angula Pani. Somebody might have mentioned about that in the previous lessons. Likewise, for Bindu, it is also body index specific. Parvadvayad Magna Samudradad. Not this one, but this one. Can you see this? Yes. Yeah. Isn't it? So, the quantity of liquid derived by collecting that which falls from the index finger, which was dipped till this level. Isn't it? That whole quantity should be considered as one bindu. So, that differs from person to person. That differs from race to race. What is one bindu for Asians is different for Africans. Might be different for Europeans. Isn't it? So for every study, first or for every practice, first we should say that this is the bindu that can be considered here. Okay. So commonly what we do is that for a different medium, for Taila, the viscosity is different. For Swarasa, the viscosity is different. For Kshira, Kashaya, all liquids, the viscosity is different. So if you dip this much and take out, how much quantity falls will be different. You have to measure that. Okay. In the case of Taila, in a very good study a few years back at Kottakkal, we found out that it can be equated to 0.5 ml. When we did it on a large sample. But it is different for Swarasa, it is different for other medium. So we have to consider that. So what we are practicing there, the Bindu Pramana is 0.5 ml for Taila. For other individual, we are seeing case by case or medium by medium. Next one. So body index specific and drug specific. So Taila, 1 bindu, 0.5 ml. For Swarasa, we had a study of Tulasi Swarasa in chronic sinusitis, exacerbation of chronic sinusitis. So for that Tulasi Swarasa, when we estimated the dose, it came only 0.25 ml. I have quoted the studies in the brackets. For Khabura, it came, another study was there, I forgot to put the dose, 0.2 ml only. Kudamanjari is mentioned as the Agri Aushadha for Amsa Roga, isn't it? Kudamanjari, Khaburanasya, the Niryasa coming from the Shalmani is taken, I think, for Kudamanjari. So that is only 0.2 ml. Then, so just a minute, previous slide. So this one is always a question mark. The pharmaceutical companies always may prompt you with a dropper. But that dropper is for patient, not for doctor. If you are doing the Nasya, you discard that, take the Gogarna take the syringe, measure it and do. That is what is better. You will get very good results, wonderful results if you practice in proper dosage, with very less effort. That is also one important. Very less effort, not with much medicines, no need of extended stay at hospital. All these things we can cover with this dosage. Next. Pratimarsha. So it will come Pratimarsha as, if you calculate 0.5 ml, the 2 bindu itself will come. Okay. Usually these Taila bottles for Nasya comes 10 ml package, isn't it? So if you write and give that to one patient, 2 din mein khatam ho jayega, isn't it? If you do that for Marsha, okay, usually what happens, even after 1 month, 2 months, patients say, that is there, still there. Don't doubt the patient because you are giving only 2 drops, isn't it? So at least try to increase the dose in Pratimarsha first. Then, one point that previous one, second. The second one is what is body index specific in case of Pratimarsha. See, it does not expel phlegm much or comes out orally on spitting. That means that is entirely dependent upon the anatomical specificity of a person, isn't it? It is not similar to all. So in case of Pratimarsha also, Acharya has tried to explain it in that way also, not only 2 bindu. You can also make variations with 2 bindu. There is freedom for us. It's not that it is only every time you have to give 2 bindu only for Pratimarsha. Some patients say, if you put this in the nostril and you ask them how phlegm is coming out or how he is expelling it, whether he is feeling the taste in the mouth, depending upon that you can make adjustments to the dose also. So that freedom is always there, only it's up to us to utilize that freedom. Next. So the indications and contraindications, I think for Pratimarsha there is not much additional to discuss because Pratimarsha is usually done in all cases. Next. Okay, this is one area where we feel actually difficulty. We say that Pratimarsha Kala are mentioned, 15 Kala in entrance questions and all. It is very commonly asked, isn't it? With such a vigorous intent we ask these questions. Once I was taking a class for a group of foreigners who accidentally were doctors also, modern medicine doctors. So one among them, a neurologist, interrupted me and asked me, in which kala you practice? Whether after laughter or whether after going out? Then I did not reply. It got me thinking what he is intending. And then he was writing all this kala. Then he is starting asking me each kala, whether you are doing Pratimarsha after this, whether you are doing Pratimarsha after this. Then I understood. He is purposefully asking with a curiosity. Then I told, no sir, we just want to share this information. So you know this for 4,000 years and you are not practicing this Pratimarsha in any of these kalas. Then why you are teaching that? So that was something like an eye-opening incident. This happened really a few years back. So when we say about the benefits of Pratimarsha in Panchadasha Kala and all, we ask the questions in the Vaiva and all these things. None of this is being practiced in real life, isn't it? Are anybody practicing? If so, they should receive a huge round of applause, because we are keeping on telling this. We are not practicing this Pratimarsha. Even with a less effort, we can do. There is no need of any other facility, isn't it? Pratimarsha is such a simple one. Ajanma maranam shastaha. In any age group we can do. Still we are not doing. So that is actually one drawback. What we say, what you have to remember. Yes. Next slide. So important indication, this is where I want to discuss some points with you. Neurological diseases, locomotor diseases, psychiatric diseases, dermatological diseases, others. So I have tried to group this on the basis of my practice. Okay. Because I am not going to tell you the textual indication, textual contraindication, which you are already teaching for several years. So I just want to discuss with how I am practicing Nasya in this set of diseases. Next slide. So the common approach that we adopt in Panchakarma with regards to Nasya. Of course, in Panchakarma, Nasya has been mentioned by Sushruta only, isn't it? It is Sushruta who mentions Nasya for Panchakarma. So first of all, we have to remember there should be a clear-cut differentiation in understanding the pathology of the stroke. That is very important. And the clinical presentation also. What kind of stroke patient you have got. Then, which kind of Nasya we have to do in that Panchakarma Rogi is entirely dependent upon this pathology and clinical presentation. If you have got a spastic case of stroke, and if you have got a flaccid case of stroke, whatever medicine or whatever kind of Nasya you are going to do will vary. Okay. Same wise, if you see the pathology, if you find a space occupying lesion, if you find a hemorrhage, if you find a infarct in the MRI, you will have to be very cautious in your approach with Nasya. Okay, I will tell you a few points. So both Virejana and Brahmana are beneficial. So you cannot say that Nasya in Panchakarma means it is Virejana only, it is Shamana only. You cannot say that. Both are beneficial, but not in the same condition, in different persons. So for that, Virejana, Karpasastyadi and Brahmana, Shuddha Bala are commonly used in Kerala. Next. So in hemorrhagic stroke, it is always better. This is my advice. If you have something to add or some different experience, you can always come up. Okay. It is always better to avoid Nasya in the initial phases. Similar approach is recommended in space occupying lesions also. In the initial phases, don't go for the Nasya. If you find in space occupying lesions, there is a marma role in the samprapti. So not that always Nasya or Panchakarma is a disease. What the marma has to do in that? You remember the Siddhisthana chapter where Nasya is mentioned? Trimarmiya Siddhi. Isn't it? So there is some role of marma also. If you find a space occupying lesion, hemorrhage, etc., there is some structural damage. You have to always try to incorporate the marma samprapti in that. In case of such conditions and in Pitta Anubandha or Rakta Anubandha, your approach is different. In Pitta Anubandha, Kshirabala Avarti is used. That is in case of hemorrhagic stroke in later phases when you are going to do Nasya. In case of space occupying lesions, you suspect the marma's involvement. There in later phases you are going to do the Dhanundaram Thailam. Then in upper motor neuron lesions, this is depending upon the location of the lesion. It is very difficult to respond, especially if it is a young case of stroke also. I have felt much difficulty in treating Panchakarma cases who are having UMN involvement and they belong to the age group of youth. It is very difficult. So there you plan for repeated course of Nasya. Not one course may not be enough. Repeated course is needed. If it is associated with aphasia, That means the clinical presentation is associated with aphasia. Try to incorporate some medhya dravya into the nasya karma, like Jyotishmadi Taila. Malkangani Tail is available with Dabar. It is nothing but Jyoti. In Kerala, Jyotishmadi Taila is not available. We have only this Jyotishmatyadi Taila, which is used for head. Pure Jyotishmadi Taila is available with North Indian companies. Malkangani Tail. We are using that. Very commonly we are using in our hospital. Next. So, from Pakshagada to Ardhida. I am happy that I did not share this slide with that Manuel Vieira, who did the systematic review. At first we did, no? If he had seen this, he would have made some other comment for this also. This is not a research work. This is what we practice. Okay, research. It's not the result of a research work I am sharing. So here the approach is similar to Pakshagada, but there is an caution, because there is an infectious background for occurrence of Ardhida also, isn't it? The pathology may sometimes be infectious also. So you always be whether there is a middle ear infection, whether there is a history of something else, some otitis media, something else which had been caused by infection. You have to be very careful. There, very important additional point you have to remember is that apart from Nasya, the medicines for Nasya may be similar, but using Sweda in between Nasya, you can have a little bit extra of that. Okay, so advise Sweda, particularly in between and after instillation. Only Charaka has mentioned this Sweda as after or a Panchakarma also of Nasya. Using Sweda after Nasya also, it's only Charaka has mentioned. Not in Ardhida, but in some other context. Advise Talam, especially that is a practice in Kerala. Some of the Kerala texts begin with Prarabdhe tu Ardhide. In the initial phase of Ardhida, Mauli Liduga, put on your head. Balamishra Hayyanga Veenam. The Hayyanga Veena means butter, Navanita. You mix that with Bala, that is the Bala Churna, and put it on the head. Near the Ta Dehnal, don't advise head bath. Palpuga Bhajada, you advise Kshira Dhuma or Kshira Bashpa. This is the Kerala line of management of, I think you have seen this Kshira Dhuma and all. Talam, Kshira Dhuma, okay. So you have to add those to the Nasya Karma in case of Ardhida. So in Ardhida, when we write Nasya, this Veda Karma will follow Kshira Dhuma, Tala will come, this Bala Tala. Okay, next. Other condition, neurological condition that we commonly practice Nasya is Avaranavada conditions or Mastishka Kshaya conditions. For example, Parkinsonism. Some of the Parkinsonism we consider as Kabhavardhavyana. Some of them we consider as Kambhavata, isn't it? Gadavata, yeah.
One question related to Ardhit, sir.
Sure, sir.
Sir, Ardhit may be due to local nerve palsy, that is 7th facial nerve palsy, or it may be due to
upper motor.
So in 7th nerve palsy, it is seen that may be due to viral infection. In that case, you are waiting for some days or directly we can...
We have to wait, sir. If there is the infection process going on, it's better not to go for this one.
Stridal therapy.
Yeah. In the other case, sometimes the same results following a tooth extraction and all. We got an interesting case. I published a case report and all. One of our UG student, she went for her dentist appointment. A tooth extraction was done. She came back with Ardhida. She has now completed internship, just now completed. In that case, there was no infection. It directly followed after that, direct injury to the nerve. We did all these things. So in such cases there is no problem. But when there is an active infection in process, you have to be little careful. Okay. Shamana Ushadis, you can give some Lakshmi Vilasaras at your place. Here we give some Mukkadi Guliga, something like that. That is better. Dashamula Kadatrayam, Vyakhriyadi Kashayam. Interestingly, in Kerala, Vyakhriyadi Kashayam is very popular. Actually, it is mentioned by Charaga, Sushoda, and Vagbada. But that Vyakhriyadi Kashayam appears in a different name in Vaishijya Ratnavali with Ardhida as indication. It is having only 3 medicines: Vyakri, Shundi, Amrita, Kvadaha, Pippali, Churna, Samyudaha. 4 medicines. It is having the different name, different indication in Vaishijya Ratnavali. And our Padma Bhushan Dr. P.K. Warrior, sir, used to prescribe this to Ardhida cases, this Vyakhriyadi Kashayam. So that kind of management you can give in that infectious background. Yeah. So coming back to the Gadavada or Mastishka Kshaya Avarnavada conditions, the Parkinsonism, we have to aim for Dosha Shodhana. We are having a series of studies at our college in Parkinsonism. We did it with Taila, we are now doing it with Churna, we are doing with Swarasa. All are aiming for Tikshna Nasya Dosha Shodhana. Other than Taila also we are doing, others also we are doing. Swarasa, Kalka mixed with Kshira. Then what will have problem with that is that if we do such Tikshna Nasya, you will have to follow it up with some Snehana Nasya also. Because sometimes Vadakoba occurs and you will have to manage that. Sometimes it will be managed by keeping Talam. Sometimes you have to do Nasya itself. Okay. Then, so for that Snehan Nasya, Rasna Dashamula Gridam. Rasna Dashamula Gridam is very commonly available in, marketed by all pharmacies. Usually it is given internally. Panchakasan, Shirakkambam, all that indications are there. Okay, next. So in ataxia-like conditions, so different from PD, there, if you are considering Tikshna Nasya, prefer Taila itself. Okay, not for Swarasa and Kalka, because there are more, maybe we have seen more complications related to Vadakoba when we are doing Swarasa Nasya, Churna Nasya and all. So we stick on to the Taila Nasya, and as per presentation, like seizures, cognitive impairment, spasticity, selective advice can be given over the Taila, whether Shirashodhana Taila or the Karpasasthyadi Taila or Shadbindu Taila, which should be given. Suitable Talam can also be added. As the Talam I mentioned for Ardhida, we can put different Talam, Kshirabala Rasnadi, like Talam in case of ataxia also. Usually we go for Panchagandha Churna, Kshirabala also. Then Kachuradi, Kshirabala also. All these are commonly practiced talams.
Sir, talam we have to put prior to Nasya?
Yeah, prior to. It is not mentioned as a procedure, but in Kerala we are doing that. Okay. And if there is no specific purpose for that talam, you can do it after the Nasya. You can keep the simple Rasnadi Churna after the Nasya also. Both can be done. Even geographically, this can also be variable. Sometimes climatically also, you can vary that. Different climate, you can use different talams. Okay. Dystonia, it is an Akshebhaga Vyadhi condition, isn't it? Very commonly you will get this writer's cramps and all these things. There Brahmana Nasya is very useful. I still remember the case of a very famous surgeon, very famous, I don't want to reveal the name, oncological surgeon who did Ayurveda treatment and he is now continuing to operate. He was having these writer's cramps. He was not able to perform the surgery. Okay, lot of cases we get good result in this writer's cramp, simple Brahmana Nasya. Then Shodhana Nasya can also be done in other cases of Akshebhaga, like focal dystonia torticollis, Manyastamba. There it is the Kaphavada Samprapti. Tukshasvedo vidhadavyo, all these things are mentioned. There you go for Churna Nasya, Tikshna Nasya, Virejana Nasya, Kabahara Nasya. You will get good result. Segmental and generalized dystonias, there I think it is cervical dystonia, then dopamine induced dystonia, many other dystonias are there. There it is little more complicated. We cannot manage that with one course or one single therapy alone. One course of Nasya or one single therapy alone. We need multiple modalities to manage that. But these simple conditions, torticollis, writer's cramps, etc., we can manage with Nasya alone. Okay, next. Motor neuron disease. This is some what we are trying. It is not that to show that there is a result in motor neuron disease with Nasya. What we are doing, how can we treat MND? It's a big challenge because most of the advanced neurological centers are leaving out these MND patients. They are just giving some trial drugs. They don't have any other option. Lot of new variants are emerging. They are seeking Ayurveda treatment. How will we manage? So we are trying many therapies in MND also. So what should be remembered is that our approach should be very apprehensive, because if there is involvement of deglutination, if there is some problem with deglutination, it is better always to avoid Nasya. Okay. Many cases result in asphyxia. Then Pradimarsha can be selected in such cases. MS, multiple sclerosis also, we can go for this Brahmana Nasya with Kshirabala, Madhyashthyadi, etc. And it is beneficial in cerebellar symptoms, especially when the patients with MS have trigeminal neuralgia. Many cases of MS have frequent attacks of trigeminal neuralgia. In that presentation, you can go for Nasya. Okay, instead of simply writing some medicine for Shirashula, you can go with that. We have some, yeah.
Motor neuron disease, as it is peripheral neuropathy, so how Nasya will work, because it is mainly acting in central nervous system?
See, sir, I don't think that neuroanatomy or our consideration of neurology, Ayurveda consideration of neurology is on par with the modern medicine. So that is why I am telling you, Nasya is explained by Charaga in Trimarmiya. Okay, so the neurology, which perspective Acharyas have discussed all these things may be different. Okay, so it's not the neuroanatomy that we learn in modern textbook alone. So if we say in Visujika, Parshnyordaha Prashasyade, how will be there is a altered gastrointestinal motility be influenced by a daha karma in your feet? Or in case of Nasya itself, the immediate Paschat karma, you go on rubbing your palms and soles, isn't it? A takradara put over the forehead cures the psoriasis in the body, isn't it? So it is very difficult to explain that in terms of the current knowledge of modern medicine. If we go on studying, if we go on observing in more set of patients, maybe there is some rationality that will come along. But we don't know, sir. That is the truth. Okay. So what we are doing, why we are doing Nasya in MND is only because considering it as a Avarana Vada, and when there is Avarana of Prana and Udana, you have to be very cautious, isn't it? So the Acharya says Gurudaram. Among the Avarana itself, the Avarana of these two are Gurudaram. So there we need to attempt all kinds of therapies. So that is why we are considering, not any particular reason. Okay. Next. So in apasmara conditions, so seizures disorders, our Kaumara Pratya department in our college have wonderful record or documentation with regarding to Pradhamana Nasya, Churna Nasya in pediatric cases, Nasika Churna, Rasnadi Churna, and even with Snehana Nasya also as a Brahmana aspect. Okay, next. In locomotor diseases like Gadavada, Manyastamba, Vishwaji, so I think we have got a cervical spondylosis case today. We will see that case and evaluate the Kabha involvement. First we have to do that, and if it is Kabha involvement is higher, you can go for Karpasasthyadi Taila at first, and then later after the Kabha Nibandha is removed, you can go for the Dhanandara Mahavarti. We have got good studies in cervical spondylosis. Dr. Devi R. Nair has done a wonderful study. And also Nasapana. I will try to show you one video clip. Nasapana. In cases where who feel difficulty to inhale by themselves, we give Nasapana also. Okay, because Pradhamana may not be possible with the liquid sometimes, so we give the Nasapana also. Then Abhabahuga like condition, Vishwaji like condition, Shodhana Nasya with Anu Taila or Karpa Sastyadi, then Brahmana Nasya with Dhanandaram, Maharaja Prasarini Tailam, Shadbindu Tailam, all this can be practice. It is already studied. Good results are there in both frozen shoulder and cervicobrachial neuralgia also. In both cases you can go for this one. Okay. Then Amanubandha conditions like AS, ankylosing spondylitis. Usually in ankylosing spondylitis you go for Sweda and Vasti. That is the most commonly practiced one. But considering the Gadavada feature, you can go for Sukshma Sneha also. Like what you mean by Sukshma Sneha is Avartana. Okay, Avartana Sahasrapaga, Shatapaga, like that. Okay. So you can select such kind of Sneha and go for that. Then, why I mentioned that is that if you go and see the commentary written by on Vrindamadhava, there is a very interesting explanation given for where to prescribe this Avartita Sneha and where to prescribe the normal Sneha. So we have been studying this concept, that is Prakriti, Vikriti concept of dosha, isn't it? What is that? Prakriti Sama Samaveda and Vikriti Vishama Samaveda, isn't it? So when there is a Prakriti Sama Samaveda, you can use the yoga as such. So if you are having Dhanandaram Tailam, you can prescribe it like that itself. When you are having a Vikriti Vishama Samaveda, where addressing the dosha samprapti is itself difficult. It is a very, very complicated situation. There you need to do something with the original yoga. So you go for the Dhanandaram Avarti instead of Dhanandaram Tailam. There is one explanation given by this Vrindamadhava commentary. Go and see that, you can find it out. So after dealing with the locomotor, neurological and locomotor, some respiratory diseases where we are successfully practicing this Nasya, we can be in chronic diseases which are associated with cough and dyspnea. There you can go with Sahadevi Surasam. Very commonly available in Kerala. Sahadevi is a plant which is very commonly available. We go for the Sahadevi Swarasa. The intent is to do the strengthening of Srotas. Urdu Jatru Srotas strengthening. Okay. In chronic sinusitis, conductive deafness, etc., we go for the Anutaila Nasya, which is at the same time Sannipada Hara or Sannipada Dosha Hara. In acute exacerbation of chronic sinusitis, so it is the same condition with different presentations. Lot of choices we have. Okay, that is what I just want your attention. Not that everything can be done everywhere. You have a lot of choices. We need to try to make use of that. Tulasi Swarasa Yoga, it can be done. Yoga means to Tulasi Swarasa you add 2 or 3 drops of honey and 1 pinch of Saindhava. That's the Tulasi Swarasa Yoga. There is no other medicine in it. Sweda has a vital role in all the above conditions. Just as I told you, Sweda intermittently we have to do in all these conditions. Okay. Then, psychiatric diseases, we got a government mental institute of Ayurveda and at Kottakkal, and also we have a postgraduate department in Manasaroga Chikitsa. Wonderful studies are happening, wonderful practice are there with Nasya. A doctor might have, he attended a CME 2 months back at Kottakkal. You might have seen that, visited that area. So in many conditions we practice this Nasya also, like Unmada, different forms of psychosis, both in positive symptoms of psychosis and the negative symptoms. We have different approach. Okay. Then sleep disorders with Ksheerabala and all, anxiety disorders, toxicology. It is one area where still lot of work is even in the level of documentation need to be done. We have not done even documentation. Many of the traditional toxicology practitioners use this Nasya as an effective tool, but we lack in documentation. We don't have enough to speak about that. Then, other dermatological diseases where we practice Nasya, scalp psoriasis, seborrheic dermatitis, especially involvement of scalp. You go for the Tuvaraka Taila Nasya. Tuvaraka Taila is available. You can prepare also. Even if you have a small pharmacy, you can prepare also. Okay. Alopecia, grey hair, Nimba Taila, simple, plain, crude Nimba Taila, very good result. It will give you good result, especially if there is endocrine involvement in that. You will get many young persons have tried this. Okay.
What is a dose?
Dose again you have to decide based on condition. Okay, with the patient. We have done till 2 ml. One of my patients, that he was an MBBS student, 18-year-old, 9-year-old, we did 2 ml in 2 installation. It is market available, you can do.
Which time do you
Course, 7 days, maximum 7 days. Because one girl was there. When that girl, what we found is that after 2 or 3 courses of this Marshanasya, 7 days each course, she did not show any improvement. And myself with the Agata Tandra physician were consulting that. Then we suggested another course, 4th course. And during that course, she developed headache, severe headache. Okay, so then we changed that to Ksheerabala. We continued the Nasya, we changed that to Ksheerabala. Then this headache came down. Okay, so you have to expect when you are going for longer duration, some complications may not be coming. Okay, you have to expect that. Kumkumadi Taila, our Shalakya department uses this wonderfully. Kumkumadi Taila for Pratimarsha. Okay, even for eye diseases also, grey hair, cosmetic purposes, you put it in nose, don't apply. Don't buy the Innis tube, buy the bottled one, 10 ml, and put it in the nose. Okay, next one. Lot of other conditions. I have just summarized. I am going to share this with you. So each one you can discuss later. So the summary of indication, Kabha and Vadakabha diseases, if you are going to practice.
But that they
Yeah. Please, sir.
in jaundice.
There is a study there. There is a study.
Practice that. What are the results?
Now, personally, I have myself has done, sir, this one. When I joined Kottakkal 11 years back, at that moment I was taking lunch from a particular hotel along with my newly joined colleagues. All of us went down with viral hepatitis, and I got cholecystic type. I did not have any result. Personally, myself, I did this. I did not get any result. That is my personal experience. But there are studies. I think Hubli, somebody is there. Same thing, Devadali is Jimudaka itself. Yes. There are some studies in the Hubli Ayurveda Mahavidyalaya. There is a study under RGHS which suggests the effect of this Jimudaka Nasya in hepatitis. Personally, I did not get result, but there are results. Okay. Then this headache. Different case. Among this post-herpetic neuralgia is an interesting condition. It's a very severe pain is that. Whatever analgesic you give, modern medicine, there is no result in that. Neuralgia develops post-herpetic infection. If you give simple nasya, give internally Panchakarma Kvadha or Kaishora Gugulu, give a course of Shashtiga and Leba, pain will come down. Keep some talam, pain will come down. Even there can. Rakta Shodhana, whatever Rakta Shodhana procedures are there, you can go for that also. There is no problem. But modern medicines won't work in that condition. Then, another important one, this is our Prasudi department work. In amenorrhea, they give Kshirabala Nasya. Okay, amenorrhea, they give Kshirabala Nasya and works wonders. It's commonly done by our Striroga department. Okay. So we'll wind up the Nasya indications like this. Next. The contraindication I am not going to discuss in it. There are the age-wise contraindication below 7 and above 80. Next. Then the general indication. General contraindication, sorry. Next. Some specific conditions. Next. So those are the other procedures that we do. Nasya with Gokarna, Nasya with Pradhamana, then this Nasapana, all these varieties we are practicing. Usually the course, somebody asked earlier, is mentioned for 7 to 21 days, but never we have done for 21 days Marsha Nasya. Maximum we have done is 9 and all, but I remember in Swastavrta, the Anudaila Vidhana, that Tasya Shidiya, actually the 7th day comes only on 13th day, isn't it? 1, 3, 5, 7, 9, 11, 13. By that only you will complete the 7-day course on alternate day. So in our department we did a study with Anudaila as Ekahandara practice. Ekahandaram. There is a reference. Ekahandaram anyacha. Anyatra saptaham tasya yoji. Okay. So daily twice you can do in Vadavyadhi. But in anyatra, in other dosha disease, you have to go for Ekahandaram. Okay. So one day Shodhan Nasya. Next day is either for rest or either for Snehana Nasya. So in this case we did rest. One day Anudaila in higher dose, rest. Third day we are going for again Nasya, like that. So daily 2 things or on alternate days. Okay, then comes the important thing, evaluation of Nasya. Just click. Evaluation of Nasya Karma. I told you at the beginning itself, the outcome evaluation is a part that has been highlighted as lacking by many modern researchers. So a proper Nasya in general should induce lightness of head, comfort to mind, comfortable sleep and awakening, pacification of disease. All these are very, very subjective parameters, isn't it? And the another drawback is comfortable sleep and awakening is a late outcome. When morning you are doing, You are not inducing sleep immediately. Only next day only you will get to know how the sleep was or how the awakening was. So immediate outcome measures need to be developed. That is very important. Okay, so if you say cleanliness of Srodo Shuddhi, what is Srodo Shuddhi? How we can operationally define Srodo Shuddhi? So in case of sinusitis, Srodo Shuddhi is just like the Vicks advertisement, isn't it? Vicks inhaler advertisement, some gas clears up the phlegm, isn't it? In case of chronic sinusitis or sinus cases, that is okay. But in case of Parkinsonism, what is Srodo Shuddhi? Is it the release of dopamine or what, something else? We don't know, isn't it? Such interesting areas we need to understand. Okay, and I think in Amrita College there was a very good study regarding cognitive functioning, isn't it? Brahmikrita. Think you can ask this faculty; they will tell you. That is a very good study. I got that study for reviewing. I read that. It's a very good study because lot of work need to be done in that area. Sir, എന്തെങ്കിലും പറയുന്നുണ്ട് സാറേ പറയും.
Presence of backoside.
എന്തായിരുന്നു അതിൽ evaluate ചെയ്ത്?
The nasya will be instilled, and the presence of this backoside air will be present in the blood.
Blood.
Yes.
Okay. So such a realistic absorption, suggested absorption, so that the blood-brain barrier is broken. And it can go. It is permeable to that. Okay. Such studies need to be evolved more and more. Then only we will understand what is the real immediate disease-wise outcome measures. So somewhere in the commentary, if you see in Virejana Adhyaya, Dalhana mentions about Chirakalina Vyabat and something like that. Some word he has used. So like that, there is a comparison of these outcome measures. If you say that after Virejana Buddhi Prasadam occurs, if you test the IQ immediately after Virejana, will there be any change? No, isn't it? So that is some late onset, isn't it? Immediate onset we have to understand. So for that, see this Sushruta explanation, Nabhya Lakhutve. He clearly says you have to feel the lightness in the abdomen. So that is something what is very close to the procedure. So immediate to the nasya also we need to develop some outcome measures which are more realistic. Then, next slide. So depending upon the kind of nasya, whether it is Virejana or Snehana, we have to evaluate the nasya karma. One additional feature that we are observing in Tikshna nasya, I think it is mentioned in Sangraha, Ashtanga Sangraha, Kshavadhu. Sometimes when we are doing with this Lashanaswarasa and all, once I remember an incident in a case of road traffic accident who underwent multiple craniotomy and developed spastic paraplegia. And he also had aphasia. In that case, we did this Lashanaswarasa Tikshna nasya, not mixed with milk directly. Lashanaswarasa. It caused severe irritation, and every day what we found was that immediately after the installation, patient got severe sneezing. Okay, we are observing some such specific features in particular nasya only, not all. Then, next. So this is based on a study conducted in our college. What we understood is that on every day to decide that today's nasya was has produced Samyak Yoga and not produced Ayoga and Adiyoga, we did an observational study with Karpasastyadi Taila in Vishwaji, and we found that Shiralakatva, Vaktra Vishuddhi, Sukha Nishwasa Uchvasa, Sukha Prabodha, of course, only on next day. Okay, next day morning. Sukha Uchvasa, Nishwasa. Now what we asked her, whether there is any difficulty to inhale or exhale. What we asked her now is that we asked her whether there is any heaviness in the head, whether she is feeling any head discomfort in the head. If there is nothing such, you can decide about going for next day also. Vaktra Vishuddhi, whether the throat is cleared, whether there is still any obstruction, whether there is still any taste of medicine, anything like that. That thing we have to ask. Next. For stoppage of nasya, this is where the disease specific Samyak Yoga need to be developed. Vigara Shamana or Vyabhat. You have to withdraw the patient from study if you see, or from the treatment if you see any Vyabhat. Okay. Next. So in case of Virejana Yoga, you will find mostly Kabha features. In case of Virejana Nasya Ayoga. So that Kabha features like itching, sticky channels, heaviness of head, all these things will come. It also worsens the disease. In the Adi Yoga, just vice versa, you will find the Vada features. There are sometimes there are improper functioning of senses because of the Vada Koba, and vacuumness of head. Such things result and worsens the disease. In Snehana Nasya, it is again the opposite of Virejana Nasya. Vada features will come in Ayoga and Kabha features will come in Adi Yoga. Okay. Now the causes of complications, usually we find that all three doshas contribute to the complications. Kshaya and Utklesha. So there Vada and Kabha are the causative factors. If you say there is much dosha kshaya after nasya, that means Vada is dominating. If you say there is much dosha utklesha, you will understand Kabha is dominating. Whereas if you find any patient with, that is what we told about in Ardhita sir, that you asked again, infection. What will happen if you do? So mostly it will result in some inflammatory conditions. Okay, Pitanubandha conditions. Okay. Next. So the causes, sometimes dose may be the causative factor. Dose can be less also, high also. Temperature of the medicine, that is very important. Acharya clearly warns us, if you do not make the medicine lukewarm and put it in the nose. Of course, in case of Swarasa, usually that is not done. Okay, in case of Swarasa, that is not done. In other media, we are doing. Also, what I understand is that Asava Arishta. Some people are practicing, especially Shalakya people are with Arishta Asavas for Nasya, Nimbamrita Asava and all. In that also, it is not made warm. That is what my understanding is. Then administration, very hurried administration, multiple, interrupted administration, all these factors may contribute to Vyabhat. Non-compliance, if the patient does not comply to the Pathya, then that also may result in Vyabhat. Posture. So, as we mentioned about the posture, head lower, foot and raised, then head tilted, all these postures. Suppose the arms and legs are not properly extended, they are flexed and all these might be contributing to Vyabhat. Next. So, management, I'll just summarize the management. Generally, in case of Kabha, Vada, Chikitsa, because Adiyoga and Ayoga, you can identify and tag it as Vyabhat due to Vada Koba and Vyabhat due to Kabha Koba. If you are going for Shamana, Talam is the most useful one. Now in that patient, as she came for OPD, we just kept Talam as the Panchakarma. That itself is enough. Okay, but that is the case of Kerala. In other places where humidity is not that much high, this talam is not required. Okay, the geoclimatic reasons need to be evaluated. So, what talam, how talam got developed in Kerala is an interesting topic for discussion, because there is a text called Arogya Raksha Kalpadrumam. Okay, have you heard? Not outside people? It's a dedicated textbook for Kaumara Bhritya, but many Kaya Chikitsa Panchakarma practices in Kerala are documented in that. Okay, so it's a Sanskrit text actually. It is available, English translation is also available. So the author calls Talam there as Pichu. He uses the term Pichu for Talam. So it is very similar to Pichu, but no cloth is used. So there is two types of tala explained. That is, one is Srodasu Kabharuddheshu Kuryad Murdhini Pichukriyam. When you find much obstruction of Srodasas due to Kabha, then go for Kuryad Murdhini Pichukriyam. Keep talam over the head. This is about Ruksha talam. Okay, the opposite is this Snigdha talam, which is used in Pakshagada like diseases. Dharayel Sadadam Murdhini Vadashani Yujaha Pijun. You can keep talam with tailas such as Vadashani taila. Okay, so there is Snigdha talam. So there are two kinds of tala in practice. One is Ruksha talam and the other one is Snigdha talam. So one is respectively done in Kabha and the other one in Vata. Okay. Then Shodhana, if you want to do the management in Shodhana line, you have to go for Nasya itself, no doubt. But that is not done much. That is Nasya as a management of complication of Nasya. That is not done much. Okay. Only the case we do is when we get Vada Kopa with Virejana Nasya, we go for Snehana Nasya. That we have done. So one day you do some Sarasa Nasya, patient gets some complication which is due to Vada Kopa. Next day you put Sneha Nasya. That we commonly do. The vice versa we have not done much. Brahmana Nasya, Ghrudamanda is an important medicine. Very, very important medicine. Can anybody say where Ghrudamanda is mentioned? Vamana Virechana Vyabhat. Okay. Pichabasti, Grahani. Okay. Gridamanda Anuvasana. Okay. Specifically, Gridamanda for Nasya is explained in Vadavyadhi also. By Charaga, by Vagbada. In Shirogada Vada. If you do the processing with the Vilva, etc., you can use that. So this Gridamanda, you have to always collaborate with a diary. Otherwise, you will not get this Gridamanda. It is very difficult to make. Even the diary people say that every batch of Grida will not yield Gridamanda. Only in certain set that will come. Okay, the formation of that manda is cannot be predicted. So that was available in market. Kerala Vaidyamadham Aushadashala was preparing that, but now they have stopped. So it is a very, very effective remedy for most of the vyabhats of Nasya, especially bleeding. If you get Pitta Rakta Vyabhat, this Gridamanda Nasya is very useful. It will arrest the bleeding. Okay. Next. So the do's, Padhya, it's a common one what we study as the part of the Ashtamahadosha, Snehajarya. You can move on with that. Okay. Don'ts also. Yeah. Okay. Now coming to the final part, the mechanism of action. So next. Yeah, we know this reference and all Nasa Hishirasodwaram, and we understand that is a pharmacological passage to the head. Next slide. So we know that all these descriptions substantiate that view, isn't it? Marma role, Indriya role, seat of Indriya, Prana, Alojaka Pitta, Tarpaga Kabha, Manas, many supportive Ayurvedic fundamentals are there describing the mode of action of Nasya. Next slide, please. Shringadaga Marma, there is a very interesting reference. Siramukhanam Sannipada Samyogasthanam. There is some typing mistake. Siramukhanam Sannipada Samyogasthanam. So the multiple vascularity of this Sringadaga Marma has been suggested. Then, so it is a Sira Marma. Next. Whatever be the pathway that Nasya gives result, it can be explained only through two ways. One is either by stimulation and other by absorption. But in case of absorption, like this study that they have done, this cognitive functioning with regards to Brahmigrada, more studies has to come, because the absorption is entirely very, very difficult to explain unless you prove that the drug crosses the blood-brain barrier. Okay. Stimulation, there are good studies. Next slide. So there is a study regarding the stimulation of neurons in CNS long back in 1990, in which olfactory receptor cells, which are in contact with the nasal cavity and CNS, provided a route of entry to the brain that circumvents blood-brain barrier. But there is no evidence that there is absorption. The evidence is only for stimulation. Then, direct route of transport of the olfactory region to CNS in animal models without prior absorption into the blood. Why? Because I am saying this is that if you see the Unmada, Basmara, Chigisa and all, some of the drugs explained for Nasya are animal excreta and all. Isn't it? If we start saying that these toxic materials are to be absorbed to produce the result, then it lands you in trouble. We don't know, because something that is non-assimilable to another mammal, how it can become, we are putting Villadi Guliga as Nasya in our Manashanti department. We powder the Villadi Guliga, which is actually prepared by grounding in goat's urine. Isn't it? And we are using that for Pradhamana Nasya. So if you start saying that that is absorbed, you owe a lot of explanation. So it is a little bit difficult. So more convenient way is, I believe, the stimulatory pathway. Next slide. Drug absorption pathway, the blood-brain barrier, how it works. This is very clearly conveying this schematic. So the vascular path transportation is possible through the pooling of nasal venous blood into the facial vein, which naturally occurs at the opposite entrance. The inferior ophthalmic vein also pool into the facial vein. This is what certain set of modern doctors also support. But there are no evidences apart from the study that they have done. Okay, so the drug, in case of absorption, the disease, there are several decisive factors explained in modern pharmacology. All these things matter. How far the drug is concentrated in that. That is why the role of Avarti in Nasya. So if you are doing with the Kshirabala 101 Avarti and with Bala Tailam, the concentration of the Bala in that is entirely different. So that influences the absorption also. Vehicle of drug delivery. If you put Bala Kwadham, as in Masha Bala Adi Kwadham, and if you put Kshira Bala Tailam, the vehicle is different. So what gets absorbed, how much it gets absorbed may differ. Mucosal contact time. So this is, today if you have observed, closely observed, the first installation in the right nostril, the medicine actually got stuck and it was slowly only inhaled by the patient, and that caused an increase in the mucosal contact time. So that itself matters. Okay, that is what modern pharmacology says. Then pH of the absorption side. See, in chronic sinusitis, in acute sinusitis, disease is the same. But if you examine the nasal mucosa or nasal secretion, the pH is different. So at what pH, what you are putting, that is also matter. Such studies we have to do. Size of drug molecule, that there is another slide. regarding the particle size. Yeah, previous one. So that means that effect of any nasal administration is a total of effect of particle size, effect of molecular size, effect of solution pH, drug lipophilicity. That is what your Brahmikrita suggests, because the drug was lipophilic. Some drugs which are hydrophilic does not absorb. Even it is true in the case of Rasayana. If you go and see the Rasayana, Lashuna, with the Taila it is explained, isn't it? Lashuna has been explained with Taila. There are a lot of studies suggesting the absorption of Lashuna with Taila. And another interesting example is the case of Bhalladaga. If you give along with olive oil, there is no Vyabhat. Usually Bhalladaga causes much problems. If you give along with olive oil, there is no much problems, less complications. So the drug lipophilicity matters, then the drug concentration, which I first told. So summarizing, next slide. The advantages of Nasya compared to the oral route of administration is that the degradation of the drug, when you give some drug orally, there are more chances of drug degradation, which is very less in case of Nasya. Then the hepatic first pass metabolism, as in case of Vastikarma, is true in Nasya also. Rapid drug absorption, if at all absorbed, it absorbs very rapidly. There is no doubt in that. Then the bioavailability of larger drug molecules can be improved by means of absorption enhancer. So if you are putting some raw medicine, unprocessed medicine, the molecule size will be bigger. So if you add something like Saindhava Lavana, something like honey, that acts as a drug enhancer. That is why if you put Tulasi Surasa, you add these things into that. Okay, next. The nasal bioavailability for smaller drug molecules is good. Usually drugs which are orally not absorbed can be delivered to the systemic circulation via this route. So far, which studies which have been conducted indicate that this route is an alternate to parenteral route. And summarizing, the vast area of our clinical practice is covered by Nasya. There is no doubt Nasya has got lot of importance in our treatment protocol. Strict and proper guidelines need to be implemented in selection of medicine, technique and dose. Next slide. Proper understanding of disease pathology in terms of dosha and subsequent utilization of Shodhana Brahmana Nasya. So please, somebody if asks you which Nasya is good in Pakshagada, you say all Nasya is good in Pakshagada. That is my request. Because Shodhana Nasya, Brahmana Nasya or any other kind of Nasya can be utilized if you keep on observing the Samprapti. Monitoring of effects of Nasya closely is essential in clinical staging. With that, few words, I would like to thank you for patient listening and also to the organizers, especially Dr. Our respected HOD for giving me this opportunity, and other manager, dean and administrators of this institute for inviting me to this course. I hope this time we spent was somehow useful. Thank you one and all.
So you have shown me the video. Then we can blow in that force. Because with very much little blow also patient will get sneezing. So with that,
Don't put it much, insert it much into the, because most of our procedures, they are easy. This one we did with the straight nozzle. Even we can do with the flexible nozzle also. Then patient will feel little comfortable. The idea is that there should be a smooth curve. It is like how you blow a conch. Shankha is the conch.
If you simply do the blowing, there will be no voice coming out from the conch. Only if you fill your mouth with air, slowly, strongly, maintain the pace of blow, then only the sound comes out from the center. Because why I am telling is that this is how my uncle and all used to practice while they were studying. So they were doing this blowing. In those days there was not that much concern. And alternate instruments were also not there. So they learned by blowing the conch. So how to regulate this, and they were blowing it directly. So instead of that, we are using this pressure. Only thing we have to be careful is that just like in Basti, there should not be continuous intermittent one. So it should be just in relation with the amount of, if it is 5 to 6 gram, you can go for multiple